Okay, good afternoon, folks. Welcome to what feels like a Monday, but it's really a Tuesday in-house human services. We have a little bit of an unusual situation in that we have an opioid advisory settlement committee and an opioid settlement fund, a special fund that, are you going to do this background?
I can, or you can.
Okay. Go ahead. Why don't you do it?
Oh, okay. Well, good afternoon. I'm Katie McGlynn, Office of Legislative Counsel. There was litigation several years ago pertaining to opioids against pharmaceutical companies. There were multiple states that were involved in the litigation and significant funds that came to the states as a result of the litigation. There were parameters put around that money that went to the states. One of the parameters was that the money had to be set aside in a special fund, and that there had to be an advisory committee that was set up by the state to advise on how money in the special fund should be utilized. And so Vermont did that. We have a advisory committee that meets every year. They provide recommendations on how the funds should be spent, but ultimately it's the General Assembly's decision how to utilize those funds. So the bill that we're to discuss today, H218, is a bill that encapsulates the advisory committee's recommendations for the use of monies from the special fund.
And so the part that's a little bit unique about this, in last year, when was the special fund created, Katie?
I would say there's been at least 2 years.
2 years, I think, yeah. So it doesn't come from the general fund. So it's been very confusing in the big bill, the state's budget, to really track the resources that are coming from the special fund. And why that's important is because some of these are programs that are initiated and supported with dollars that actually are just appropriated from year to year. And so when you look at the big bill for last year, Act what, Lori? Act 113. When you look at Act 113, the budget from last year, you have to look in several different places in order to really see what was funded from the opioid settlement fund. And so the administration asked if this year we could appropriate all the funds in one bill. And so after consulting with appropriations, it's not a general fund. And so we all agreed it would be easier to track. So that's what 218 is. So it's a little bit different than some things. And you'll see as you move through this, for people who this is your first time at it, some bills have appropriations, some bills don't. Some bills start with appropriations and some bills have it taken out depending upon where they go. And the Senate has different ways of doing things than the House does sometimes, and vice versa. So we have H218, and Katie's going to walk through that for us.
Okay, so this is session law because we know these are one-time appropriations coming out of the opioid special fund. So in fiscal year 2026, the following sums shall be appropriated from the opioid abatement special fund. And we have where the fund is located in statute. I should say the first, I think, 4 appropriations, they have a subdivision A and B. Those are reoccurring appropriations where the General Assembly has spoken in the past and said we would like to see this continued every year. So that language is duplicated here, but those are all requests that have been made in previous pieces of legislation. So first, in subdivision 1A, $1,976,000 to the Department of Health to fund 26 outreach or case management staff positions within the preferred provider network for the provision of services that increase motivation of and engagement with individuals with substance use disorder in settings such as police barracks, shelters, social service organizations, and elsewhere in the community. And then we have this intent language. It is the intent of the General Assembly that these positions shall be funded annually by the opioid abatement special fund unless and until the special fund does not have sufficient monies to fund this expenditure. In subdivision 2, $1.1 million to the Department of Health for the purpose of awarding grants to the city of Burlington for establishing an overdose prevention center upon submission of a grant proposal that has been approved by the city of Burlington City Council and meet the requirements set up around prevention centers and statute, including guidelines developed by the health department. And again, we have this intent language. It is the intent of the General Assembly to continue to appropriate funds from the special fund through fiscal year 2028 for the purpose of awarding grants to the city of Burlington for the operation of the Overdose Prevention Center, unless and until the special fund does not have sufficient monies to fund the expenditure. Subdivision 3, $1.2 million to the Department of Health for recovery residences certified by the Vermont Alliance for Recovery Residences, including at least 2 new recovery residences certified by the Vermont Alliance for Recovery Residences. Intent language again, it is the intent of the General Assembly that recovery residences may be funded annually at not less than fiscal year 2025 levels, unless and until the special fund does not have sufficient monies to fund the expenditure. In subdivision 4, $1,050,000 to the Department of Health for syringe services. Last time with the intent language, it's the intent of the General Assembly that syringe services be funded annually at not less than fiscal year 25 levels, unless and until the special fund does not have sufficient monies to fund the expenditure. And then we continue on with our list. Subdivision 5, $800,000 to the Department of Health for grants to providers for ongoing support or contingency management. Subdivision 6, $32,157 to the Department of Health for distribution to the Brattleboro Fire Department to establish community training programs on the administration of opioid antagonists, CPR, first aid, and stop the bleed protocols. Subdivision 7, $44,229 to the Department of Health for distribution to the Champlain Housing Trust to continue a pilot program providing access to wound care and preventative health care and 3 low barrier shelters within Chittenden County. Subdivision 8, $800,000 to the Department for DCF, Department for Children and Families, Office of Economic Opportunity, to support long-term programs at shelters for individuals experiencing homelessness, including harm reduction supports and clinical nursing programs. In subdivision 9, $309,000 to the Department of Health for HCRS's Project Connection Works to reduce opioid use disorder, morbidity, and mortality in Windham County through prevention, treatment, and recovery services. Subdivision 10, $35,000 to DOC for distribution to Pathways Vermont to implement a contingency management pilot program in Chittenden County for individuals under the supervision of the Department of Corrections. In subdivision 11, $50,000 to the judicial branch to train Vermont's judges on issues related to opioid use disorder. And
That's 50,000, right?
50, yes, what did I say?
It's got like extra zero.
Oh, yeah.
Oh, goodness, thank you, yes, that's not 50,000. And strategies for use in dockets statewide. In subdivision 12, $76,000 to the Department of Health for distribution to Vermonters for criminal justice reform to fund an outreach worker position. In subdivision 13, $200,000 to the Department of Health for distribution to Elevate Youth Services to establish healthy youth program counselors at the Basement Teen Center at Kellogg Hubbard Library in Washington County. In subdivision 14, $100,000 to the Department of Health for distribution to Friends for Change Youth Center for the purpose of delivering intervention strategies and harm reduction supports to youth and young adults. Subdivision 15, 170,000 to the Department of Health for distribution to Spectrum Youth and Family Services for 2 new positions to expand opioid use disorder screening, treatment, and case management services to youth in Chittenden and Franklin counties. In subdivision 16, 80,000 to the Department of Health for distribution to Prevent Child Abuse Vermont for the purpose of teaching parenting skills and providing social and emotional parenting supports for individuals with opioid use disorder. Subdivision 17, 850,000 to Dale for distribution to Higher Ability Vermont to provide specialized employment services for individuals with opioid use disorder in Burlington, Newport, Rutland, and Bennington. In subdivision 18, 550,000 to the Department of Health for distribution to the Northeast Kingdom Community Action to hire 4 peer support specialists to assist individuals with opioid use disorder who are transitioning out of homelessness into safe permanent housing. In subdivision 19, 150,000 to the Department of Health for distribution to Connecticut Valley Addiction Services to expand opioid use treatment in rural Windsor County. Subdivision 20, 300,000 to the Department of Health for distribution to Vermonters for Criminal Justice Reform and the Johnson Health Center to continue and improve the Managed Medical Response Partnership. Subdivision 21, 30,000 to the Department of Health for distribution to Treatment Associates of Washington County Mental Health to hire an embedded recovery coach. And lastly, subdivision 22, 20,824 to the Department of Health for distribution to Umbrella to provide integrated services between domestic and sexual violence providers and partners in recovery in Northeastern Vermont. And then we have language in subsection B that all grant agreements associated with funds appropriated pursuant to this section are to require outcome and measurements data to be collected and reported to the department issuing the grant. Expect July 1, 2023.
So, we'll have to, take a look at, I guess, we should do our due diligence in making sure that these amounts, the ones in the first 4 areas are the same amounts that were, I know the 1.1 is, but, the other ones are the same amounts that were appropriated in Act 1, whatever the number is. AJ, thank you. And so we didn't get any language from the department on things that, so for instance, we know that the Overdose Prevention Center has not been initiated yet. They haven't made any grant agreement. They have money this year. So we'll deal with that when we take testimony. This is going to be a little bit different. So our health department team is going to get helped out by us taking testimony because we have a bona fide bill that we need to do our due diligence on. So we'll be taking testimony on the elements here, both from the advisory committee, from advisory committee members, as well as from the department. And this was just to give you a overview because it's something we need to, it's a money bill. We need to get it out of here by crossover. So we're going to be including this in our work plan between now and crossover date. So people have any questions for Katie? Go ahead, Doug.
I have a couple. We have a sense as to how many years Vermont will continue to receive funds through the abatement?
I'm trying to remember what it was. Was it 10 years? 10 years. Okay, we can get that for you.
But it's not ending next year.
It's not ending next year, no.
And did we receive additional funding? I mean, it was a recent settlement that was.
It was drafted open-ended originally, anticipating that there could be other settlements and we would want to add those funds to the special fund.
Yeah, I believe it was
20 years. It could be. I really can't remember now.
And with the possibility of additional funds, would the amount received go down in out years or only stay steady or go up?
These are JFO questions.
For those first 4 sections sort of had that special language about the legislature's desire for it to continue. Then there's a list of however many more, another 10 allocations are some of those repeats from prior years or just hasn't been a commitment to codify that it should be ongoing, or are they sort of the other is all new each year? Is there a vision for
It's
that?
it's a mixture.
It's a mixture.
Mhm.
Contingency management is a repeat.
Okay.
Yeah. That's why I have to go back and look at the big bill to make sure, but, just a second, Nolan. Like the positions, the 26 outreach or case management staff position. That seems to be worded a bit differently than what I'm remembering it from last year.
Division 1A.
Yeah.
Okay.
Yeah. If it's the same positions, I was thinking about the ones that were going out to, and we were building on the pilot program that corrections had. And I was thinking that this is the language, or this is the area.
I did not match it to last year's budget. I was working from the document that the health department provided, so it,
Yeah.
yeah, it doesn't, it wasn't drawn from that. So if you want identical language to replace this, we can certainly pull up.
I don't know as we need identical language. I just want to match up,
Okay.
kind of what, Representative Bishop is talking about. I want to match up, the things that we funded last year that maybe we didn't put that sort of intent language behind with some of these. Nolan,
Just for the record, no language with this one. I'll put together a sheet showing you each year so you can see it side by side.
okay, thank you. Thank you. Do you know what the balance is in the account right now?
No.
Okay, so that would be helpful too, when we start taking testimony on the bill. Okay.
And then just a final question, and it relates a little bit to that 26, and then also with the recovery residences, the two. I guess just going forward, clarification. I wasn't aware of the history, so as I read this last night and looking at it to Fund 26, was that 26 new positions or just continue ongoing funding? It sounds like that's ongoing funding, 26 existing.
That's why we need to match this up to the big bill and see, because those 26 positions sounds like the corrections, case management, outreach, post discharge from corrections. That's what I'm remembering, but I could be misremembering it. And then we should take a look at the language, Katie, because I'm not sure that we said, like, I'm trying to remember honestly, so I want to see what the language says in the big bill about, we sort of had a general statement in the big bill to the extent that I'm not sure it referred to like these first four.
It wasn't just in the big bill. This is sprinkled throughout a few pieces of legislation where
Okay.
there is language that says, maybe not this identical language, but language that says it's the intent to have this be ongoing.
Okay.
And the last, and maybe it'll become clearer when we see a document, the 1.2 million for the recovery residences, specifically looking at including at least 2 new recovery residences. Is this part of a larger plan? Was there's similar language? So there was 2 added last year. We're looking to add 2 this year. And so it's a part of a growth plan, if you will, of recovery
We'll find out.
residences? Yeah. Okay, thank you.
Go ahead.
Apologies, there's 12 million in the fund,
Okay.
For this year.
unappropriated 12 million.
Yes, I did.
Yeah, go ahead.
How was it decided what organizations get the money? Because there's so many in need.
So we'll take testimony from the department and then from, I don't know if they have, the commissioner is the chair. I don't know if they have a, sort of self-appointed vice chair or whatever, but we'll take testimony. There's an application process. There's a proposal process that people submit proposals to this advisory committee that was established. And I think, Katie, it might be a good idea for us to pull up the bill that created the advisory committee to review with folks when we start to take testimony on this.
And that also has all of the authorized uses for the special fund.
Yeah,
That could be it.
that'd be good background for people to
And
have.
that could be what it
Yeah.
is.
Dan?
Just quickly on the recovery residences, creating 2 new recovery residences, but does that include any additional funds for existing recovery residents, or are we level funding?
Including, so that means that it goes to existing and including 2 new.
Okay, so it is, there's more.
It's money,
there.
it's money for existing and 2 new.
Okay. Well, just making sure. level funding like we've been talking about on each 13.
Well, this may be in fact the same dollar amount. So it could in fact be level funded. I don't know. We'll check with the FY 25 budget and see. Any other questions for Katie? Or Nolan? Thank you for being here, Nolan. I'm sorry I didn't have a cookie for you. Okay, great. Thanks, Katie. So, I'm gonna task the VDH budget group to look at H883. That's because I can't remember act numbers. It's last year's budget and match up what's in that budget with what's on this list, okay? And the language. 113, thank you, Act 113. Pardon me?
No one said he'll do that, so he can assist it.
Nolan said that he will provide assistance to the team.
Assistant group, whoever they are.
All right.
Thanks very much.
And we should probably look at 222 as well. Because I think there were appropriations made in 222 as well. Okay, all right, great. Are other witnesses here?
Dr. Levine's on.
Oh, right there. Okay,
Just not here yet.
that's okay. We'll get started. Katie, maybe can we put you back in the hot seat just for a minute?
Sure.
Just to review with us the, just because it seems more official when you do it rather than when I do it. On our website, we have an excerpt from that references the opioid settlement advisory committee. And it's essentially amending the bill that created the opioid settlement.
Oh, from
advisory
last year's
committee.
budget?
Yeah.
Okay. This I don't think shows the strike throughs, so.
This is the language it passed.
Right, but it came through an email, and I think the email didn't show the strike throughs. Let me look at.
Well, it's essentially so there was some disagreement last year in process, in terms of, there was a lawsuit filed by the ACLU that, disputed the process which was, carried out in terms of making recommendations. And so, what was made clear was that the opioid settlement committee itself could issue recommendations and the commissioner could issue recommendations based upon the work of the opioid settlement committee. So this is essentially that language.
So this is language that was in last year's budget. You can see that it's amending codified law, so we're amending what has been put in statute when the advisory committee was created. So annually, the advisory committee shall vote on its recommendations. And if the recommendations are supported by an affirmative vote of the majority, the majority agrees, the advisory committee shall present its recommendations for expenditure from the special fund established pursuant to this subchapter to the Department of Health and concurrently submit its recommendations in writing to the various legislative committees. The advisory committee shall give priority consideration to services requiring funding on an ongoing basis. So this language doesn't have the underlines and strike throughs, but the vote piece is new, that the committee would vote to determine if a majority of the committee agreed. And then also the language that the advisory committee could directly submit their recommendations to the General Assembly. It doesn't necessarily have to go through the health department.
So that was a change that we made last year. And so you'll see when we review the bill that this is the statute that this is amending, you'll see sort of what the original was and then how this amended it. So part of our oversight and accountability is to check in with the commissioner and to check in. We tried a couple of different members of the advisory committee. We did former Representative Dane Whitman, who sat on this committee, was a member of the advisory committee. We were unable to reach him, however, but we do have a current member of the advisory committee, Jess Kirby, as well as Dr. Levine here. So to talk about from their perspectives, whether or not this sort of change in process has been something that's been helpful or clarified anything. And there had been ongoing feedback about sort of the process of the advisory committee, and like feedback all the way around. It depends on who you talk to, what you heard. So Commissioner, welcome, and welcome, Jess. Nice to see you both. And Dr. Levine, if you could just really give us from your perspective, any change in process that occurred as a result of the amendment to the statute last year.
Sure. Mark Levine, Commissioner of Health. Good to see you all again. Sorry I'm not there in person, but I'm in and out of a meeting here in Waterbury with this in between. Maybe it'd be helpful just to go over some of the formalization of process that occurred this year. As you know, the advisory committee is charged with providing recommendations to the General Assembly and to the Department of Health regarding the use of the special fund. And the statutes direct the committee to develop its recommendations in consultation with individuals with living experience with opioid use disorder, frontline support professionals, the Substance Misuse Oversight Prevention and Advisory Council, and other stakeholders, and to consider the impact of opioid use disorder on communities throughout Vermont, the perspectives of and proposals from opioid use disorder prevention coalitions, recovery centers, medication-assisted treatment providers, and the ongoing challenges of the opioid crisis on marginalized populations, including those with lived experience with opioid use disorder. The process for developing these recommendations is not further prescribed in statute. As my letter to the Appropriations Committee and this committee indicate each year, including the current one, we utilize the Johns Hopkins University principles for distributing opioid settlement funds, and actually expanded them a bit to make sure that geographic equity was one of the forms of equity that we pursued and followed. So this year, what evolved is we developed a process for how we accept and review applications for funding from the community. And the committee reviewed and approved this process at its April and June 2024 meetings. And it's very simple number of steps. We issue a request for applications, RFA, that's we meaning the Department of Health, for settlement funds, and require in response a description of the proposed project, what needs it's going to address, and how much funding it's requesting. All the committee members then have a chance to independently review all the applications that are received and have a vote that determines whether each proposal should be further considered or not. If the proposal is approved for further consideration, we then task the submitter with an invitation to attend a committee meeting with a more formal presentation to give us more details and to submit a detailed budget. After all of the proposals that have been verbally presented to the committee, have done that, the committee then has another vote to decide on the merits of those proposals, whether they strongly or somewhat support or do not support the proposal. And then finally, the committee had the opportunity to discuss the results of the votes at a meeting in December 2024, at which time they affirmed the findings of the votes as for what the committee wanted to recommend for funding in 2025. At this meeting, the committee also confirmed that it wanted to recommend continued funding for 4 programs that the General Assembly had expressed the intent to continue funding in fiscal year 2026. And we recommended and approved recommending continued funding for another proposal, contingency management. All of the votes that were done, which were using Microsoft Forms, were made public during the meetings and in response to public records requests. We had an expert in ethics speak with the committee in May. And based on this expert's guidance, committee members recused themselves from voting when they thought that would be appropriate. The next phase, of course, was then to compile the letter. And as you know, there are 2 letters that are compiled. The department compiled the committee's recommendations into a letter, shared the letter with the committee members via email, asked for any technical edits or substantive objections, and received none. If they had been received, we would have reconvened the committee for yet another meeting to reconsider the letter and the recommendations considered therein. But since there were no objections, the Department of Health separately drafted and submitted to the Assembly its recommendations for use of the special fund in 2026. And these recommendations aligned completely with the recommendations of the committee. So 2 letters, one coming from the committee itself, one coming from the Commissioner of Health, representing the Department of Health, which were completely aligned. I guess your original question was, did the change in the legislation have an impact? Well, it certainly created the requirement for these 2 letters in case one differed in any way from the other, which it did not this year. And it really did emphasize many months that the committee deliberated this year on process. And the process is what I've outlined for you. I will say it, as any time you discuss process, as you all know, it can become quite laborious. And this was a big burden that the committee bore for a number of months earlier in the year. But I do believe it was quite satisfactorily handled, and there was complete consensus amongst committee members. And even 1 or 2 of the advocates who come to all of the meetings seem to be satisfied with the decision-making and the process that occurred. I guess I can stop there.
Thank you, Commissioner Levine. Can I ask, did the committee, thank you for outlining the process and all the discussions that happened. Did the committee vote on, as you were developing the process, did the committee vote on the actual process, not the specific recommendations for funding, but did they vote on the actual process?
Yes, and that's why it went on for a number of months. We wanted to make sure all of the input that was received was incorporated. And then we took a vote to make sure that we had gotten it right, so to speak.
Okay. Did you have your hand up?
I do have a question. I hope it's germane here,
Okay.
but if we have a particular question about a line item that was cut in the 2026 budget compared to last year. And like wanting to understand the logic behind some of those decisions, who is the best person to direct those questions to?
Specifically from the opioid
Yes.
settlement fund.
Yeah, and I'm looking particularly at the scholarship for recovery residences.
Okay, so we'll talk about
Okay.
that when we talk about H218.
Okay.
Okay, this part was just really to talk about like trying to address the change in process for the committee. Rep. Garofano.
Thank you. Thank you, Dr. Levine, for laying out the process. I have two questions. One, it looks like the new bill talks about that the grant agreements and the organizations are going to be submitting outcome and measurement data back to the agency or department that issues the grant. So I'm wondering, is there part of the process for those outcomes and performance measures to come back to the advisory committee to help inform your future decisions? That's my first question. I have a second one.
You know, I think that we should be informed by that. The problem is there's a genuine lag time because a lot of time has gone by between the letter we sent, the committees in the legislature reviewing all the materials and the eventual budget actually being enacted. So from that point on, these proposals, if they're all approved, then get enacted. But as we know from experience, that can take well over several months, if not 6 months to a year in some cases. So there will be a significant lag time before we could be informed on many of these. Obviously, this year, we'd love to be informed about Overdose Prevention Center in Burlington. But here we are in February, and there's yet to be a site or manager of that program named. And we know that will take time for the actual structures and staffing and everything else to occur. So it's going to be a significant lag between when we know what we would like to know about outcomes and when they might occur.
Thanks for that. Just quick follow-up for my second question. So I encourage maybe the department or the advisory committee to kind of consider maybe in future, as we fund these programs, maybe have some kind of dashboard on the department's website as information becomes available on the outcomes of these programs. So the public and the General Assembly can have an easy place to kind of look to see what outcomes were achieved by funding these programs across the state. So, and then my second question was, anywhere in the process, is there consideration to services that might already be, so when you're reviewing the applications from the proposals, are you looking to see if these services are already being provided in some other way in that community? So kind of to try to avoid duplicative services of if it's case management or, whatever it is, is that already happening on the ground in that community or nearby where it can be maybe expanded? Or do you guys get that deep into the researching the proposals?
Those are the kinds of questions that would normally be asked at the time the presentation of the proposal would be made. So while I wouldn't be able to guarantee in every case that happened, my sense is it's usually part of the presentation, and if it isn't, we ask questions about it. Because you're right. One of the principles that we use for making recommendations is that they not be duplicative and that we don't supplant in case there's other already funding a portion of what the proposal has to offer. So we have to be careful about that.
Thank
Okay.
you.
Thank you. All right, let's move to Jess. Jess, welcome this afternoon. Nice to see you again.
Nice to see you
and
as well.
we we kind of putting you on the spot because you're only one of many members of the opioid settlement advisory committee. And we're just trying to get a sense from, a committee member. And if you have others that you think that we should speak to, just let us know. We did try reaching former Rep. Whitman, but we're unsuccessful in doing that. Just trying to get from as a committee member, we know that there was kind of some process issues perhaps that existed prior to what the commissioners outlined, and just wondering if from a committee member's perspective, if you feel like there has been like if those things have been addressed.
Definitely. I am happy to be here and try to provide what perspective I can on that. So for those of you who don't know me, my name is Jess Kirby. I'm the Director of Client Services at VCJR, or Vermonters for Criminal Justice Reform. We have a low barrier program, so we work with people who are really struggling in Chittenden County, and a lot of people that are very high risk for overdose, a lot of people who are, experiencing polysubstance use and challenges with treatment. And so I'm really happy to help provide what perspective I can from somebody that's currently doing this work with people who are really at highest risk of overdose death. I'm also a person with lived experience myself. I struggle with opioid use disorder since I was probably 13. And that was, a big part of my life and has really shaped who I am and kind of what I bring to this process and my work, etc. But I just want to say that I'm really glad that we're here talking about this. I'm really happy and excited, and I've talked to a few other committee members before I came, just seeing if other people were kind of feeling similarly. I'm really happy about the processes that we've come up with. I think that we appreciated the legislation around it, and I think I feel really heard in terms of wanting and we were starting out and doing something new. None of us had ever done this before, so the first couple of years are going to be challenges and show us what areas we have for improvement, and that definitely happened. I feel like the process that Dr. Levine laid out was really designed by committee members, and that our feedback was really heard in terms of wanting there to be official votes and not wanting to do a tier process, and wanting to talk in person or on Zoom about each thing and have opportunities to really give feedback on that. And I think this year felt really good in terms of organization, in terms of voting, in terms of being able to hear from the programs that we had voted that we wanted to hear more from. And I'm really glad that we kind of came up with this portal idea where people can submit requests, because I think a lot of people in the community were maybe a month after that period closed, were like, hey, I had a great idea, and people didn't really know a lot about how to maybe make requests. So I feel really good about that we had requests from all over the state. Things were recommended, programs from all over the state were recommended. And so I think in terms of process, I and a few of the people that I've spoken to feel really good that we have a process that we can use going forward. And so I'm happy about that. Representative Garofano, the question that you brought up about hearing outcomes from things that maybe are getting ongoing funding, I think that's probably would make sense for that kind of to be our next step this year in terms of having a process for that, because there's challenges with it. Just like Dr. Levine was saying, it's hard. OPC hasn't opened yet. How are we supposed to hear back about that? But the vast majority of community members really support that and want there to be funding for that. And some of them are new, but there are things like contingency management, which I really strongly support, that have been funded for a few years, that, we still don't have a really great idea kind of how many people are utilizing it, what are being done with the funds, what types of programs are they doing with the funding that they're getting. And so it feels like we've had really broad strokes on some of the things that we've recommended. And so we're kind of recommending again based off of really supporting the idea as a strategy, but not really because we know and understand that it's effectively, working here in Vermont or that it's serving a lot of people. I don't know if that makes sense. So I think it'll be nice, hopefully this year and as years go on to kind of get like a better look at what's going on with some of the things that we're continuing to fund. And I think, quite a few of us are really looking forward to that. And, I really appreciate being a part of this process so much as somebody that, struggled with, oxys back in the day and really brought me to, a lot of really negative experiences in my life. And so it means a lot to me to be part of it. And I'm really glad that our legislature and the Department of Health has really heard us so well about like wanting a process. It feels really good where it's at right now. And I'm excited about years to come now that we have this going.
Thank you, Jess. One of the questions that I had, so when we were talking about who to have for testimony to talk about this process, it lays out that the commissioner is the chair of the group. And is there a co-chair or is there some other, member of the group that has a leadership responsibility as well?
There's not. And I think, one thing that's really tough about this process is that, most of us are people that are all working professionally in the field in some way. And time constraints are very difficult in terms of how often we meet, what's laid out for that legislatively. And we expanded that and meet a lot more often than we were in the beginning, but we don't have a co-chair. I do feel like the commissioner has done a really great job of bringing everything to us and asking like, okay, where's the committee at on this, and not just deciding things for us.
Yeah.
So I'm really happy about that. But it is something, and one thing that's been really hard for me as somebody that really values this process. I come to every meeting, I participate, I read every single proposal. And, it's been hard kind of some of the feedback from the community in terms of like, why didn't, this get funded? And, those kinds of things, and people feeling like we should have done like a large needs assessment across the whole state. And, I think like that the community doesn't really understand that this isn't like a full-time job, that we don't work for the state, that we don't, that we're people that are trying to do the best we can from the roles that we're in to provide our perspectives on these really important issues. So that's been hard. Some of that has been hard to hear. And I haven't really known how to I think it's something that we should talk about, in terms of maybe posting something on the website that says, like, this is the role of the, opioid settlement committee, because I think there's a lot of confusion about what kind of our job is and how big it is. So anyway, I hope that answered your question. We don't have a co-chair at this time, but, I do think it would be good.
Well, and I see your hand up, Dr. Levine. I think so I'm going to ask you, because we are going to, in the next couple of weeks, we're going to be taking up H218, which is essentially the recommendations for funding out of the opioid settlement fund. And so we will need to be taking testimony, and certainly we will have Commissioner Levine back to talk about the specific recommendations, but I also want to respect the process of the committee. And if there is a committee spokesperson who would also like to testify on the recommendations, if you could, it's somehow in maybe working with the commissioner or, sort of polling your fellow committee members to see who would like to speak on behalf of the committee, the other committee members, in addition to the commissioner, that would be very helpful.
Okay, yeah, I can send an email to the committee, and we are, we do communicate a lot by email. So I'd be happy to put that out to the group, and I really appreciate you, asking that. So
okay, thank you. Dr. Levine.
And we can also, I believe we have a meeting next week, so we can mention this next week.
Oh, great. That time is perfect.
It's perfect timing. With regard to the chair part, I don't have it in front of me, but if you review the statute that designed the committee, it does comment on the Commissioner of Health being the non-voting chair. I don't think it says anything about a co-chair in it. So we could nominally name somebody for sure, but it's not one of the things that was sort of designed into the committee structure, if you will.
Yes, I recall that too, Commissioner, and I was then struck with like, okay, well, you know, who do we select from among the other members to give us their perspective? And so we went with people that we know.
No, and then my only other answer is, we talked about measuring outcomes and putting it on the website. So obviously we have a lot of process outcomes. We just don't have major clinical outcomes. So the contingency management that Jess referred to, you know, we've been funding it several years. So process outcomes are the number of people who are trained in contingency management now across all the treatment providers around the state. And it's practically everyone. So that's great news. But then how are their clients, if you will, responding to that modality of treatment? That's going to take some time to gather data and figure out. Similarly, outreach workers for case management and finding people in places where we normally don't look to see if they are in need of help regarding their substance use. We know who's hired in terms of the treatment provider and SSP communities, who's hired, how many they've hired, did all the money get used for those slots? And the answer is yes, but then that's great. But now what's the outcome of having those people? And do we actually improve the health of even more Vermonters, because we are finding them providing a trusted connecting point for them. And eventually they're going to deal with their substance use disorder in a very productive way. So we can certainly do the process outcomes, but the others do take more time, unfortunately.
Thank you. Anybody have any sort of final questions for either of these witnesses today? Representative Steady.
So we have people that have come here looking for monies from the opioid. Shouldn't we refer them to this committee so it's all in one place and not all different committees using these funds?
That's what we do. Mhm.
Oh, okay, that's what we do.
Yeah.
I know there was somebody else that came looking for 500,000.
Oh, well, no, we have lots of people looking for money.
So we just refer them, so it's all going through one flow.
If it's something that's appropriate for the Opioid Settlement Advisory Committee to consider, we would refer them to the portal that they have on the Health Department website. And it's actually pretty easy to find, which I appreciate it, because not all of the state's websites are as easy to navigate. So kudos.
Can I just add to that? There's very specific uses for that money by legislation. So not any request would qualify.
Okay.
For
We're gonna review the,
You're asking.
yeah, we're gonna review the base legislation before we do H218. So if you have the background.
They're saying the breadth of scope is quite broad. So it'd be hard for me to imagine something that didn't fit into what's in the legislation already, because it's really, really broad. I would also point out that just as the portal is accessible, the minutes to our committee meetings are very accessible, and they demonstrate where we took votes, et cetera. So that's recorded in there.
Thank you.
And it was very helpful. I found that's where, it's very easy to find all of the members and their contact information and stuff like that. So thank you for making that accessible to the public. Thank you both for being here this afternoon. Appreciate it. And we'll be back in touch about H218 in the not too distant future.
Thank you. Have a
Thank
good day,
you.
everyone.
Thanks for moving ahead on 218 as well. Appreciate it.
Okay, take care.
Bye.
Bye-bye. Okay. Welcome.
Yeah, thank you.
No one needs a break.
We haven't been at it that long.
Okay.
We're going to do, well, this is your first time in our
committee this year? Yes, I think it is. I'm just trying to remember if you were here for one of the other days we had. So why don't we just do a quick around the room so you know who you're speaking with, and somebody's got their. Well, this is your first time in our committee this year. Zach Caprice. I'm just trying to remember if you were here for one of the other days we had.
Excellent.
All right, thank you. Okay, she's watching us on YouTube. Okay.
She should be coming into, yes.
Okay. Okay. I was just gonna wait till she comes back online, so we don't have to do this twice. I know, she's coming back in. Oh, we have paper. Extra paper. It's online, yeah,
Yeah. Wasn't.
I know. Our committee doesn't do too much paper, which, I mean, some people still prefer it, but.
Not you. I love my paper. Oh, that's okay.
Okay, here's Caprice back. Okay. So, we're going to do a brief round of introductions. I'm Teresa Wood from Waterbury, and I also serve Bolton, Buell, Score, and Huntington.
Hi, Ray Garofano. Nice to see you, Kathleen. Essex and Essex Township.
Jubilee McCarroll, and I represent Bridgeport, Middlebury, New Haven, and Lake.
Hi, I'm Esme Cole of Hartford.
Hi, my name is Zon Eastis from Guilford. I serve in Guilford and Vernon.
Good afternoon, Todd Nielsen, I represent Brandon Forest.
Doug Bishop, represent Colchester's Chittenden 20 District.
Brenda Steady, East Milton, Westford.
Hi, good afternoon, Eric McGuire, representative for Rutland City.
Hi, good afternoon. I'm Dan Noyes. I represent Belvedere, Hyde Park, Johnson, and Woolkit.
Hello, Ann Donahue from Northfield and also represent Berlin.
See you again.
And we'll go right around the outside, Polly.
Hi, I'm Polly Major and Policy Director for the Vermont Housing Conservation Board.
I am Beverly Bobek, the Vermont Women's Childhood Advocacy Alliance. I am Alice Crambles, I'm a policy advocate with the ACLU Alliance.
Lori, committee assistant.
And Caprice, why don't you introduce yourself too while we're at it?
Great. I'm Caprice Hover. I'm the Special Project Manager for the Vermont State Housing Authority.
And Kathleen, the floor is yours.
Wonderful, thank you. Well, for the record, my name is Kathleen Burke. I'm the Executive Director of the Vermont State Housing Authority. Thank you for inviting us in to present today. I'm going to begin my presentation with just a general overview of who we are, the work that we do here in the state of Vermont. I'm going to focus on those federally funded programs that we administer that leverage state and local resources. And then I'm going to pivot and have Caprice talk about some grant programs that we administer on behalf of the state of Vermont. And then I'll take it back and wrap it up, if that sounds good.
Sounds good, thank you. And just let us know, do you prefer us to wait with questions or how do you prefer questions?
Whatever you would like, I'm happy to intercept questions as we move through, if that's
Okay, for you.
either way. So beginning with who we are. The Vermont State Housing Authority was established in 1968. It has the distinction of being the first statewide housing authority in the country, thanks to Governor Phil Hoff at the time. We were founded by an act of the state legislature. The authority was given a charge to improve housing conditions and expand housing opportunities for families of very low, and moderate income. The VSHA is not a department. Is not a department of state government, but is referred to as a quasi-governmental body whose enabling statute permits it to own and operate affordable housing. The VSHA Board of Commissioners is appointed by the governor and confirmed by the Vermont Senate. The State Housing Authority was created for the purpose of improving housing conditions and facilities through federal resources and assistance in the field of low rent housing and private accommodations.
our mission to ensure that quality, affordable housing opportunities are available to Vermonters statewide. Who we are. The core programs of the authority are strongly impacted by actions at the federal level. We've all been hearing a lot about that over the last couple of weeks. But Section 8 and continuum of care programs and the housing programs of USDA rural development are funded by acts of Congress.
So, well, maybe you're going to get to that now. I was just going to ask about sort of current state of affairs for Section 8 subsidies.
Sure, I can certainly speak to that. It's a lot that we just don't know. A lot of chaos. You're hearing, I'm sure, bits and pieces coming out to the media. What we were advised by Housing and Urban Development in early December is that the best case scenario for Section 8 vouchers for funding this year would be that the program would be funded at a proration of what is actually needed to fund the program. And that proration is likely to be between 88% of need and 97% of need. So in essence, what that means is that we would not have enough funding to serve all of the families that are currently receiving assistance.
So when you say that range, that wasn't just your ability to serve new applicants, that would be your ability to meet the financial commitments that had already been made and are ongoing for people.
Right. Well, more specifically, that range is based on bills that are floating through Congress right now. There's a Senate bill and there's a House bill. One version is recommending that the Housing Choice Voucher program be funded at 88% of need, and the other is funded at 97.5% of need. And so where will those negotiations land? We don't know. I will say, I've been in the business now for over 35 years. I've been through some rocky times, as it relates to federal funding. I worked through sequestration in years past. I think I'm not sure that those experiences are going to allow me to make judgments on how these programs will be treated with this administration going forward.
I guess I need to be clear in my own mind. So is it a possibility that people who are that have a currently active subsidy and who are in apartments and with rental assistance happening, that they may not have that continue in the future?
It is a possibility. I will share with you that I have been talking with the local public housing authorities around the state regularly. We believe that if the voucher program is funded at the 97.5% of need estimate, that collectively we would be able to work through that. Now, what that means is that we would continue to serve those families that we're currently serving. We would allow natural attrition within the program, meaning, the program has about 12% attrition, families going off for various reasons. That attrition would happen naturally, but we would not be serving new families. We would not be issuing rental assistance subsidies to our waiting list. If the worst case scenario were to happen, the 88.6%, that would be a scenario by which public housing authorities would have to remove families from the program now in order to come in line with the budget that would be provided to us. I can't allow myself to go there. The Housing Choice Voucher program has been a bipartisan supported program forever. I mean, it's a very successful program, and I have to believe at the end of the day that there will be continued support for the program, but I'm also a realist. I do believe that there are going to be substantial cuts to the program. Exactly what that means, I can't tell you right now.
Thank you. That's helpful.
So VSHA administers the largest portfolio of federally funded Section 8 rental subsidies in Vermont, and we administer federally funded homeless assistance funding. Many of the programs administered by the agency require case management services, usually under the terms of a memorandum of understanding with the service agency. 60% of the new vouchers that our agency issued last year went to homeless households.
And like, how many is that?
That would be approximately 423 vouchers.
Go ahead, Representative McGuire.
Yes, I don't mean to flip back some of the questions that were just presented. I don't know if you can answer this or not. What would be that fiscal gap for your agency if it would only get funded at 97%? What would be the fiscal gap for the full funding, or what would be the fiscal gap for the 88%?
I can tell you that. I don't have that number off the top of my head. I've done the analysis and I'm happy to follow up with that.
Terrific, thank you.
Yeah, absolutely.
Cool.
I know of those 400 plus vouchers that you mentioned, are all of them able to be applied? Has there been able to use them in housing, or have they struggled to acquire something they can use your voucher for?
So, I mean, certainly, there's many dynamics at play here. We have an affordable housing crisis. There's not a large supply of available housing. Housing is expensive. Landlords can make choices about who they rent to, right? They have tenant selection policies. So the 423 folks that are currently housed were successful, but there's a larger number that I've not reported out on that were unsuccessful.
Okay, thank you.
You all set, Representative Eastman? Okay.
It works that way also. We support the creation of affordable housing by awarding Section 8 project-based vouchers to housing developers, supporting the work of the HCB and the Vermont Housing Finance Agency. We manage multifamily affordable housing, and we manage the largest portfolio of mobile home parks in the state of Vermont. This slide is a little busy and I apologize for that, but really what I wanted to illustrate here is that our program, the Vermont State Housing Authority's Housing Choice Voucher Program, is serving approximately 4,400 Vermonters. But that funding comes into the state to us in very targeted ways. And so you can see listed here are the various targeted programs that we administer, and those programs have to go to a very specific cohort of individuals. And most of these programs require case management services, and so those services are leveraged as part of that rental assistance resource that the federal government is bringing to us, to the state of Vermont. And so just to put more of a lens on this, our Foster Youth to Independence program, that's permanent rental assistance provided to youth in the foster care system with case management services provided by Elevate Youth, Spectrum Youth Services. Our family unification program, again, that's permanent rental assistance, the case management requirement provided through DCF or Family Services. Our veteran supportive housing program, again, permanent rental assistance with case management provided by the VA Medical Center. Again, those services are supported through a federal appropriation through the VA, and there's not a requirement that the state leverage those case management services in that example.
Go ahead, yeah.
Is there data out there that indicates, because you talked about some of these programs being connected with case management, required case management services. Is there data out there that demonstrates whether long-term housing solutions are improved with case management, that it's making a difference?
Well, certainly there's data that would tell us the duration that a family has been receiving rent subsidy and has been successful in their housing, which I would argue, if they're successful in their housing, then they're likely receiving effective case management services or did and no longer need those services and are able to live independently and manage their households. I can certainly provide that to you.
Yeah, be curious.
Okay.
Thank you.
So moving on, again, we're talking about programs that we administer that require case management services that are leveraged. Our HOPWA program, again, that's federal rental assistance that we actually administer for the Vermont Housing and Conservation Board. Case management services are provided through 8 service organizations. Stability vouchers, permanent rental assistance, case management provided by a homeless service organization is a requirement. Our emergency housing vouchers, you can see lots of little targeted programs. Permanent rental assistance, case management provided by a domestic violence agency.
Kathleen, thank you for this information. So about the case management and the different kind of categories, are there any standards for the case management? Is it like they all have to provide certain services, or is it just each funding stream and each? I'm just trying to figure out if there's any integration or consistency.
It could be adopted across programs, for example.
Or
that
they exist right now.
Well, there are standards that exist. So for example, our family unification program, which you are familiar with from your past experiences, operates under the terms and conditions of a memorandum of understanding with DCF Family Services and Housing and Urban Development. To receive funding for those subsidies require that MOU have certain elements and required that there be certain standards around case management services. So that is an example of a program that does have standards. And then there are others, unfortunately, HUD is a very siloed organization and they don't have a standard recommended, these are recommendations or requirements for case management. So each program tends to have their own criteria, really depending on the targeted population that's being served. So again, a busy slide. I'm sorry, I'll walk you through this. But again, just pointing out our Section 8 project-based vouchers that are dedicated to homeless households, and there are several hundred. This is a relationship where we have a contract with a property owner for housing assistance payments. That contract is usually for a term of 20 years. With services provided under the terms of a memorandum of understanding with a homeless service organization. Again, referrals for these units, for these apartments, are made through the Continuum of Care coordinated entry process. Our federally funded Continuum of Care homeless assistance grants. Our Shelter Plus Care program is a form of permanent rental assistance, and so the grant funds are used for rental assistance. However, there is a requirement that we leverage case management services, and those case management services are provided through traditional homeless service organizations. Through our Continuum of Care grant funds, we are also, this is a new program. We just stood up a program that we are calling Away Home. And these are service dollars. The grants are providing service dollars for case management services that go to homeless service organizations. and I'll illustrate this in a better way. We look at the three-legged stool. So this program is providing service dollars to service providers. And so an example of that is Pathways Vermont, the Upper Valley Haven. They're receiving grant funds that support service dollars. So they have funds to pay staff. They have funds to provide security deposits. Our vouchers are providing the rental assistance to housing communities that have agreed to set aside units within their communities for homeless households. Okay, so to give you a sense, again, this is a new initiative. We currently have 66 units that are dedicated for homeless folks in 7 projects across 4 counties. Approximately $1.2 million is being provided in service dollars through the service grant. And the value of the rental assistance for these 66 units is approximately $700,000 a year. And that's housing assistance payments that are funded through Housing and Urban Development through our Housing Choice Voucher program.
So Kathleen, how do you choose the organizations to provide these services? What I'm sort of being struck with, there seems to be a number of different avenues to fund service coordination, case management services. This is another one that we're learning about. The HOP grants are ones that fund case management services. The COC funds directly case management services. It seems like not a very well integrated system.
I have to agree. I think, again, I think of HUD as a siloed organization. I think, we're all very well intentioned and we're doing really good work. But I wouldn't say that there's duplication. I don't believe that there's duplication. But I do believe that we go about our work in a very siloed kind of way. And in terms of how we allocate funds, we're required to comply with informal requests for proposals. And so we compete, be it for the service dollars that were awarded through Away Home or through our project-based voucher awards. And so we put those out for competition, and interested entities step forward and submit a proposal, and then we award based on those proposals.
Thank you. Mm-hmm. It's just something that, to Representative Bishop's question around outcomes, and we hear there are better outcomes when you have case management services as part of that sort of wraparound support for an individual who's homeless, and yet how you access those case management services can be quite different depending upon the funding source, and what you get could be quite different also depending upon the funding source. And as we look at that as really a necessary element to help people move out of homelessness, trying to make sure that we're not duplicating something that exists already is really important, because we have limited state dollars to invest. And I'm not exactly sure how we ensure that yet.
I really like this model, again, of the Away Home. Again, we've got about 2 years of experience and we're just building out the program now. But we have fabulous partners that are on board, and to date it's proven to be hugely successful. Again, we have properties where there are dedicated units for homeless households. We have a commitment of rental assistance that's being provided by the Vermont State Housing Authority. And then the services are being provided by the Upper Valley Haven or Pathways, but those funds are coming from Housing and Urban Development. And so, part of the issue with services and provision of services is the lack of just the lack of staff that are available to provide those, and in many instances, the lack of funds available to go to those organizations that are trying to make those services available. The Away Home model is we've got the funds coming from Housing and Urban Development. They've been committed to a service organization like the Upper Valley Haven, who is obligated to support the individuals that have been referred to. There's 3 properties in White River that have Away Home funding. And it's also because the Upper Valley Haven is the local coordinated entry provider. They're able to, they're making the referrals to Twin Pines Housing Trust in this example for those homeless units. They're also the service provider. And so it's just a nice, it really has proven to work really, really well. Great collaboration. The services are there. The Upper Valley Haven has a strong presence in the White River Junction area. So that's just an example of something that is working well.
Thank you.
And now we're going to pivot to those grant programs that our agency is administering on behalf of state government. And I would actually like my colleague, Caprice, if she's still here, to report out on those initiatives.
Sure. Thank you very much for having us today. I cannot see you at the moment, but now I can. So the Vermont State Housing Authority oversees the rental arrears eviction prevention program, which was the program that was legislatively committed to us last year. And we received the funds in December, and we are seeing some pretty incredible stuff. We do a 2-page analysis. One is basically an eligibility analysis, as the other is the application, where we can determine where funds are coming from and what's happening for folks. We do have an average cost that we can get into later, but really it's about folks that are falling behind for one reason or another. We've had situations where a spouse has passed away, where someone became very, very sick and had 3 surgeries. So a lot of medical, death, divorce, that's what we're seeing, ensuring that the unit is sustainable. And then both parties, both the landlord and the tenant, are deciding to move forward and make this tenancy valuable and sustainable. The Landlord Relief Program was a program that was started with the partnership of the Office of Economic Opportunity. We have been in that program for about 2 years. It really is about maintaining relationships with landlords, as well as making sure that there's an opportunity for anyone that is exiting homeless or coming into homelessness. Those units are still available. Those programs provide vacancy loss for damages, vacancy loss for early termination. We do a lot of vacancy to hold. For example, when someone has identified a unit, sometimes it can take a little time to get an inspection or to get the person in. We don't want the landlord to lose that opportunity of continuity and funding. So we created vacancy loss. It also helps with a lot of our VHIP partners who, once they receive the commitment that they will be able to access those VHIP dollars, we are actually able to release 1 month of vacancy loss in the interim. And then once they have leased up through the partnership with the coordinated entry programs, we can then release the second month of vacancy loss. Again, just really trying to make sure that our partners in this, the private and nonprofit landlords, are not really losing funds and making life more difficult to sustain these units as costs increase. We also have a manufactured home improvement and repair program. This was created by the legislature through ARPA funds and then with state general fund dollars. This is really also about maintaining housing and helping folks who lose their housing through fire or flood or other causes beyond their control, so they're able to maintain or repair or get new homes through the new MIP program, the Rapid Response Mobile Home Infill Program. has really just launched this past fall, and that is taking vacant lots and making sure that there's a partnership with the Agency of Transportation and with park owners in order to take vacant lots and have folks be able to move into them. It really was created out of the response for the floods that were happening in multi-years, and trying to make opportunities for folks that were losing their homes to find other places, as well as open up really a stretch of affordability housing that a lot of us have seen for a long time. Owning a mobile home can be and is an affordable opportunity for folks who are moving out of rentals or have lost their housing through other opportunities. We also partner with the Department of Mental Health Subsidies. I think Kathleen talked about that a little bit with the Shelter Plus Care program, and then the Department of Health Transitional Housing Assistance. I think a key piece to remember about these programs, and I'd like to just share really a couple of specific examples. Just recently in the Brattleboro area, we had a young man who had multiple surgeries to address his issues. He'd been a 6-year tenant, but fell significantly behind on rent when he needed to go in and out of the hospital. And we were able to save that tenancy. One of the things that the attorney for the landlord was appreciative of is when the rental arrears eviction prevention program is brought to light, it really isn't about when we actually literally ask the question, have you received funding? Have you tried to receive other funding to resolve this eviction? As we really don't want to duplicate funding. So we ask that from everyone. What we found sometimes is that they have received assistance potentially, but it didn't cure the eviction last time. So they're on these payment plans that can be very difficult for them to maintain. The attorney was really thrilled about the fact that this is a one-stop shop where the landlords and the tenants agree that this is something that can move forward on, and there are no payment plans. The attorney fees are taken care of so that everybody's getting a clean slate to move forward, and you get rid of the anxiety that can happen in eviction. Now, we do require that a court summons and complaint be initiated, because this really is truly about eviction prevention. It's not really, if it's someone you're not going to maintain a tenancy, you're not going to apply for this program. If it's someone that's a couple of months behind and can access other programs, this is not the route you want to go.
Caprice, excuse me, do you want to advance the slide, please?
Oh, sorry. I didn't realize I was still sharing, but here we go. From current slide. Okay. So this is the goals of the programs, really about increasing the inventory and providing access to folks coming out of coordinated entry agencies. So what does eviction prevention really look like in dollars and cents? We received the funds in December. We initiated, and so far we've had 53 requests to date. We have resolved 8 evictions. The average approval amount, inclusive of legal fees and damages, is $9,000 at this point. Our forecasted burn rate is where we're a little concerned. The overall grant was 2.5 million at the burn rate that we're anticipating. These funds will not make it through the full fiscal year. We will run out in September of 2025.
Please, you said the average approval is roughly $9,000. That seems to be more than a couple of months worth of rent.
No, we've got several apartments that are $2,000. You've also got our legal fees are averaging around $1,500. So this is not just the back rent. This is also clearing the legal fees.
Okay, I thought you said exclusive of legal fees, inclusive of legal fees.
Inclusive.
Okay.
Inclusive of legal fees.
Thank you.
And also we are seeing two things really. As we all know, when VRAP ended, there was a real hiccup in the system. So we are seeing situations where oftentimes the private sector is cautious about going, like they don't want to evict the people, right? It's much harder. It's much more expensive. There's a lot of reasons you don't evict someone. So they more often than not are waiting 4, 5, 6 months before they, really start that eviction, because they're really trying to work with the families, and the families will pay a little bit and then try. But once you fall behind, it's too hard to catch up. So we've got everything from our nonprofit partners who are familiar with the eviction process, don't let things go 3-4 months behind. So those numbers are a little higher. And then we have the private sector that you may get someone that hasn't been able to, it's not every month, but they have paid a portion of the month for 6, 8, 10 months and have never paid the whole amount.
So a question I have, I guess, that, that we had with the other services when we were talking about case management is, so through the HOP grants, several of our homelessness service providers also provide rental arrearages payments to people, not part necessarily of a sort of like this formal program that was initiated last year. So how do you coordinate with them and assure that these dollars are going to the best use?
Well, part of the challenge with HOP is that it is different in every area of the state, correct? Not all areas actually do back rent as part of it. Not all areas will actually cure the eviction. They may do 1 month, but there's 3 or 4 months. And so that's when you find the folks find themselves in a situation where they'll pay 1 month, get the eviction stalled, but then the client is on a payment plan that may not be affordable for them. The other piece is that the attorney's fees are tacked on. No one's paying the legal fees. Or, for example, tenant damage that may, that we haven't had a lot of that, honestly. There was a couple for $200. So the damages isn't really being a part, but we wanted to, just in case that was an issue. So we don't just ask about HOP. I mean, HOP is one of many community service agency opportunities for folks to get support for back rent. We are not able to consistently tell which community has which rules. So some will allow you to have eviction prevention 1 year, but then you cannot get any assistance for 3 years. So if life happens twice, 2 years in a row, like a situation I'm working with right now, where it was a health provider. She is a care aide in our health system, and during COVID lost dollars, was able to rebound a little bit, but then her client got MRSA. She came down with MRSA. She's had multiple, she was overpaid unemployment dollars during COVID, so she had to repay that. So she's got back on track. She's recognized and reconciled the things she needed to do. But over that course of 2.5 years, she's fallen 6 months behind. That landlord still wants to work with her. She has done all the things she's supposed to do. So we will resolve that eviction. And she is a 5-year tenant. And none of those situations are like most of the HOP. And again, each agency has their own rules. So that's why all we can do is ask and have the client tell us, have you worked with a community agency to address your back rent challenge? And they need to tell us if they have, or if they were denied, if they were approved. And unfortunately, they're not necessarily always resolving the eviction for the long haul.
Thank you.
When I talk about the mobile home improvement and repair program, we call it MER. Again, folks don't often think about this as around our affordable housing and housing crisis that we have in Vermont. But in reality, what we see on a daily basis are homes that really are in significant need of repair in order to remain habitable. We have helped many folks through the FEMA doesn't cover everything, as you all know. So some of our dollars is really about trying to help those folks get back into their home and have the running water in their home. Not everything is covered. So our average approval rate and this covers infill, which helps make sure lots are available for new homes. It covers home repairs to make sure that folks are able to stay housed safely. And then it also covers a foundation opportunity where oftentimes we partner with CHT and their down payment assistance program and other opportunities. But even when you have all of that, the affordability of a mortgage on a mobile home, having that $15,000 foundation grant allows that mortgage to occur because we're reducing the costs for the homeowners. I'm sure you're familiar, we recently, as in November, launched our mobile home mobile home infill program. And this is about home ownership. It is about addressing the flooding that occurred in the 2 years. We had our first closing on Friday, which is great. And as some of you know, I've said for years, anytime you have a new program, you learn everything you didn't know you were going to learn in the first 6 to 8 months. We are certainly doing that. And I think collaboration between the Agency of Transportation and Agency of Commerce and Community Development to make sure that these 100 homes are going to occur. The lots are coming. We have 99 lots identified and people ready to move forward. Now it's marrying the homeowners, and we recently made a contract with a realtor to help us identify continued homeowners.
And so from there, I'll continue and finish up.
Thanks, Kathleen.
Any questions on anything that Caprice may have presented on before I move forward? A lot. So just to recap, VSHA provides services that reach more than 8,500 Vermonters. Okay, we are on the front lines working with tenants, working with landlords. That's what we do. Our legislative priorities for this session. The first is continued funding for our rental arrears or eviction prevention initiative. As Caprice said, this program is on track to run out of funding at the end of June. And so to keep this program operational into the future, that would need an additional appropriation. And we estimate that to be $2.5 million if we were to run this program through the next fiscal year.
So that was one-time money that was appropriated for 25? Okay.
One-time money. And so touching on the federal funding outlook, we touched on this earlier in the conversation. Federal funding situation is bleak at best. We're operating now under a continuing resolution to keep federal agencies funded through March 14th. The hope is that ideally we'd have a spending bill. That's probably not going to be the case. There could be another short-term continuing resolution. There could also be a government shutdown if they can't come to an agreement. So we talked about the rising cost of housing assistance payments and what that 97.5% proration could mean. I would ask this committee and all committees, as you're thinking about your work and this session, knowing that there is going to be reduced funding, federal funding to support the programs that we administer this year and likely in perpetuity for the next couple of years. There are a number of programs that we administer that require supportive services. And without those supportive service dollars that are leveraged, those federal rental assistance resources will be at risk.
So, for the people who are in, I guess the people who are at risk, the potential, what does that mean in dollar amounts?
I'll have to let you know.
Okay.
It's a big number.
Okay. We're trying to gauge, what our potential risks are, and it would be really helpful to have that number. And it doesn't have to be perfect, but
It'll be a projection. It won't be perfect.
Yeah.
A projection of what we estimate that to be.
Okay, thank you. And the other thing, is I appreciated what was being said about we have a lot of variability from region to region on what's covered in HOP grants, what isn't covered, and it's an RFP process that kind of seeks to fund whatever applications get submitted, and so there was a lot of discussion last year when this rental assistance program was being initiated because of, potential for duplication with existing funding sources. And what would be if the HOP program no longer funded rental assistance? What do you estimate the demand for your services would be?
Much greater. And I would need to sit down and run that analysis. But you say rental assistance or you mean rent arrearage?
Well, rent arrearage.
And certainly, we can try to estimate that. I mean, it has been challenging to understand the intricacies of HOP as it's administered around the state. As we were standing up the eviction prevention program, being very cognizant of not duplicating other benefits. I heard that loud and clear last year. Naturally, I went to OEO and asked, for a rolled up policy of what the different HOP agencies do, and that's not available. You really need to go to each entity. And so the way that we decided to manage that in standing up our eviction prevention program was to have applicants who come to our program self-attest that they've not received another type of benefit for this same for rent arrearage. And so that's how that's being managed. But I also, with eviction prevention, it's a very nuanced program because it's for sustainable tenancies. So we go through an analysis of determining if we cure the eviction, will this tenancy be sustainable? Meaning, will the tenant be able to continue to pay their rent going forward and maintain that tenancy? To receive benefits, the answer to that has to be yes. If they can't because they don't have the cash resources to pay the rent, we're not going to pay the benefit and cure the eviction. So this is a program for non-payment of rent for sustainable tenancies.
Yeah, I mean,
Sorry.
No, that's okay. Caprice, go ahead. I think we understand that. And I think it was created that way on purpose, I think. And we're just, as we consider H91 and consider what a emergency shelter program looks like in the state, what are the necessary components of that? And what are the things where we have existing resources being used for something that maybe we might need to prioritize in a different way? And thinking about what are the ripple effects of, those potential decisions. That's why I was asking about what would be the potential cost increase for the program that you all have designed here, which seems pretty comprehensive. It seems, pretty well thought out in terms of what are the implications for the individuals as well as the sort of effective use of the resources. And, I think we need a little more information from some of the HOP recipients to understand exactly how do their, what seems similar programs, like, I have no idea if they pay for legal assistance or not, and that it brought a question to my mind because I thought there was a separate grant to legal aid for legal assistance for this same category. So I'm trying to figure out why we're paying for legal assistance twice.
So the grant that went to Vermont Legal Aid is different in that it's a pilot to serve 2 counties in the state. And it's really what they're piloting is sort of this public defender type of approach. So if families who are under eviction in those counties, if they had legal representation, what does that look like? What does that mean for them? Would there be better outcomes? So it's a very specific pilot to look at that model and study that model.
There isn't a program, Terry, sorry. There isn't a program that offsets the cost to the landlords. Because the landlords, that's the legal fees that the rental assistance eviction prevention program. It's really for the property.
For the landlords.
For the landlords. And it's really critical to understand. I think when Kathleen uses the word nuanced, I'd like to just kind of share with you what that looks and feels like. So these entries can come from anywhere. They can come from a property manager, they can come from a tenant. And our role at VSHA is to either work with a landlord liaison, which unfortunately we are losing part of those programs. So the VSHA is really the ones having the conversation, filling out the eligibility application if there's not a partner there with the tenants, as well as negotiating with the landlords and explaining to them what the program is and what it isn't, and really trying to be that negotiator between the two. We have been successful in reducing the cost per month in situations. We haven't necessarily been yet successful in reducing the amount, which I also try to do. But as far as eligibility, we've had a couple of situations where when I've said to the landlord, if you lowered the rent by $100, this would be sustainable. And if they want that tenant, they're lowering the rent. I wish everyone would be able to do that, because we are running into situations where the even at 40%, when you have a voucher, the market rent is so high, people still are paying out of their own pocket, and it's more than 40% when they have a subsidy. I think that's also critical to understand.
Yeah, thank you, Caprice.
And so I want to be sensitive to your time, and we've taken a lot of it this afternoon, so thank you. I just want to leave you with a couple of things. One is you think about sort of duplication of programs and programs that are doing similar things, but yet different things, and be mindful of the landlord relief program that we're also administering. That's a risk pool for landlords, does not pay for non-payment of rent. It could. That is a program that was funded by the legislature in 2023, really came out with just very few guardrails in terms of how that program had to be administered. It is a grant. It was funds that went to the Office of Economic Opportunity, sub-granted to the Vermont State Housing Authority. And so that program is administered through policy. Okay, so if we're part of what we're wanting to do is fewer programs that really do similar things and putting money in the right buckets and knowing who's administering them, that would be a logical directive that you all could make. And then
I want to make sure I'm understanding a logical directive to do what?
Would be, so I guess two things. I mean, if we're going to be, would be to direct that the landlord, the eviction, not the landlord relief program, so many acronyms and programs, landlord relief program be available for eviction prevention initiatives. That's been decided by policy by the Office of Economic Opportunity. Now, likely, if you were to do that, then it would need increased appropriation. Right now, we project to have funding for that program through this year. We would be back to you all next year looking for increased appropriation to keep the funding going beyond next year. But if that program was going to take on additional uses, obviously the burn rate is going to be greater. We're going to be making more grants, and so it would run out of money sooner.
So you confused me a little bit. I'll admit it. No, I mean, I got what you said, that, we should potentially look at the landlord relief program as being available for eviction prevention. Isn't that what the rental arrearage assistance fund is used for?
Right, but that program's going to run out of money by June. And so I'm already thinking about next year.
Okay, so you wouldn't be considering, it would be consolidating those.
Consolidating and perhaps considering an increased appropriation to the landlord relief program, which also provides for eviction prevention.
Okay, all right, gotcha.
Thank you.
And
then lastly, H91, I just wanted to call out, on the federal level, there is a movement right now to really dismantle Housing First. And so I did note in H91 that the program would require Housing First practices. And so just calling that to your attention. And really what they're talking about on the federal level is mandating services and as a condition of occupancy. So not sure where that's going to go, but just wanted to bring awareness to this committee as you're looking at that bill. Thank you.
Yeah, go ahead.
The two programs with the landlord relief and the eviction prevention programs.
That's
those are
right.
Both statewide.
They are.
Okay.
And they both bring resources to landlords and tenants.
Thank you. Thank you both very much for your testimony this afternoon. It really helps us to sort of set the landscape of thinking about how to best tackle the issues to reduce the number of people who are homeless and what that might take. So really
Happy to come back and chat more and share experiences or provide data. So
thank you so much.
the opportunity.
Appreciate it. Thank you, Caprice.
Thank you. Have a great day.
Thank you. Okay, I see we have the HCB here. We're going to take just a 10-minute brief break, if that's okay.